By law, Medicare drug plans are required to include any pharmacy that is willing to accept the reimbursement rates and plan requirements into the drug plan pharmacy network. These plans are called Any Willing Provider plans or broad networks. However, many health plans form networks they call cost-sharing networks or preferred pharmacy networks, which are deemed legal by CMS. Think of these plans very similar to your health insurance, in which you probably have in-network and out-of-network providers. As a patient, you're monetarily incentivized to use an in-network provider by lower copays and usually required to pay more out-of-pocket if you visit an out-of-network provider. Most Medicare plans design their prescription drug coverage using network pharmacies, commonly known as preferred or non-preferred. Let's go over the fundamental differences between preferred and non-preferred network access. Medicare patients in plans with a preferred pharmacy network are incentivized to use preferred pharmacies over non-preferred pharmacies by paying lower copays and out-of-pocket expenses. Pharmacies wishing to participate in these preferred networks are asked to accept lower reimbursement rates and are many times held accountable for their pharmacy performance scores and aiding the drug plan in achieving their CMS star ratings. This is achieved through collecting DIR fees from the pharmacy. Overall, pharmacy reimbursement is lower when participating in a preferred network than it would be to remain non-preferred. On the other hand, if a pharmacy is non-preferred, patients may experience higher copays and out-of-pocket expenses and be less inclined to fill their prescriptions at that pharmacy. However, the pharmacy in turn will likely have lower or no DIR fees recouped, as well as higher reimbursement rates. It is important to remember that not all plans have a preferred copay structure. For these plans, patients will pay the same copay at all pharmacies regardless of preferred status. Additionally, the copay structure will be different for each CMS plan, and the difference between a preferred copay and non-preferred may not be significant. If your pharmacy has a large population of dual-eligible patients that have both Medicare and Medicaid, there will not be a copay differential in using a preferred or non-preferred pharmacy. This means they will not be incentivized by lower costs to go to a preferred pharmacy. So what does all of this mean? Medicare patients are still able to fill their medications at your pharmacy, regardless of your preferred status. Our PSAO has a panel of pharmacy owners that votes on certain key contracts on behalf of our network. In some cases, the reimbursement rates and profitability are so low for a drug plan that our panel votes to accept the non-preferred contract on behalf of our PSAO. This is the crux of our contracting strategy: access that makes sense. We want to ensure our contracting decisions are made by pharmacy owners for pharmacy owners. For more information on Medicare Part D, please visit the Cardinal Health Open Enrollment website.